At me. I'm Kaylee Abfalter, and this is my audience: Tanner, Sydney, and Leo's over there too. All right. People often wonder if psychologists would give better care to their patients if they were allowed to prescribe medication. Psychologists spend more time with their patients than a medical doctor or a psychiatrist would, and they get to know their behaviors and diagnoses better than anyone. A psychologist should be able to treat the whole person, making doctors more available, and students would be more willing to go to school since there would be less school than going to med school to become a psychiatrist. Several states already have adopted this policy, such as New Mexico and Arizona, where psychologists are allowed to prescribe medications. A psychologist should be able to treat the whole person. They should be able to provide assessment, psychotherapy, and medication to assure that nothing is miscommunicated between the doctors. Patients seeing a psychiatrist often report that the doctor demonstrates poor compliance with the psychologist's recommended treatment plan, according to an article by Kay Lavoie. Sometimes it's hard to get an appointment to see one professional, let alone trying to get two different appointments for therapy and for med changes. Having a psychologist and a psychiatrist all in one makes for more availability of the doctors. It can take weeks to get in to see a psychiatrist, which could interfere with the therapy from the psychologist. If a patient is assessed and diagnosed by a psychologist, and they have to wait to start their meds, their treatment would take way longer. A psychiatrist may not be available in certain areas due to lack of psychiatrists. According to an article by Mark Baird, psychologists having prescription rights would make students more likely to choose this path. Curriculum would be changed to meet the APA standards for prescription rights. Students would not have to go to a full medical school, as they would only prescribe psychiatric medications. An article by Karen Norfleet says that if this were to go in place, PhD curriculums would be changed to add training in how meds are made up and how they react with the body for psychologists. Giving psychologists prescription rights would benefit the treatment of their patients. Psychologists should be able to treat the whole person, making doctors more available, and more students would be willing to go to school for it and help the community due to not having to do all the extra school to become a psychiatrist. This debate is not about having a psychologist expand their services, but to help this society and get them out of the rut of the failing healthcare system. And this is my audience: Tanner and Sydney.